9 warning signs of stroke 1 month before. Stroke, a sudden interruption of blood flow to the brain, is a serious health problem that can have life-altering consequences. Although most people think that stroke symptoms only appear suddenly and severely, it is important to recognize that the warning signs the body gives can be subtle and appear up to a month before the stroke occurs. Knowing these early signs can help detect stroke and prevent you from suffering from this problem, compromising your health. In this video, we will explore 9 warning signs of stroke that appear a month before having an attack. High blood pressure. High blood pressure, clinically known as hypertension, is a prevalent but often undetected precursor to stroke. It has earned the nickname, silent killer, because it usually has no noticeable symptoms. However, high blood pressure is an important risk factor for stroke. Blood pressure is the force of blood against the walls of the arteries. When this pressure remains consistently high, it can damage arteries and cause them to narrow. This, in turn, increases the risk of blood clots, or ruptured arteries, which can lead to strokes. Although high blood pressure itself may not generate overt signs, it can silently lay the foundation for a catastrophic event. 1 month before a stroke, some individuals can experience mild symptoms, such as occasional dizziness, transient blurred vision, or mild headaches due to high blood pressure. These symptoms can serve as warning signs that the cardiovascular system is under pressure and requires attention. It's vital to monitor your blood pressure regularly, especially if you have a family history of high blood pressure or stroke. Lifestyle modifications play a crucial role in managing high blood pressure, including adopting a heart-healthy, low-salt diet, engaging in regular physical activity, managing stress, and avoiding excessive consumption of alcohol and tobacco. In cases of more severe hypertension, a doctor may prescribe medications to help keep blood pressure within safe limits. Proper treatment of high blood pressure significantly reduces the risk of stroke, highlighting the importance of early detection and intervention. Fatigue. Excessive tiredness can be a warning sign that something is wrong in your body. Although fatigue is a common human experience, a sudden and persistent feeling of tiredness, out of proportion to your daily activities, can be an indication that your circulatory system is struggling to efficiently deliver oxygen and nutrients to your brain. This reduced blood flow can be an early indicator of a potential stroke risk. The brain is a highly demanding organ, requiring a consistent supply of oxygen and glucose to function optimally. Reduced blood flow to the brain can result from several factors, including narrowing of blood vessels due to atherosclerosis, blood clots, or other cardiovascular problems. When the brain doesn't receive the oxygen and nutrients it needs, it can cause feelings of fatigue, sluggishness, and an overall decrease in energy levels. Chronic fatigue can also be associated with other stroke risk factors, such as sleep apnea, obesity, or cardiovascular health problems. Recognizing and addressing these underlying factors can reduce the risk of a future stroke. So, if you feel constantly tired despite adequate rest, this is a sign that deserves investigation. Seeing a healthcare professional for a comprehensive evaluation can help identify the root cause of fatigue and address it before it turns into a more critical health problem. Vision problems. Vision problems, although often associated with eye health, can be a worrying precursor to a stroke. Your eyes are windows to your overall health, and sudden changes in vision, such as blurriness, double vision, or the appearance of a blind spot, can be significant warning signs. These visual disturbances can be caused by damage to the small blood vessels that supply the eyes. When these small vessels become compromised, it can cause problems with retinal blood flow, affecting vision. Early diagnosis and treatment are vital to mitigating the risk of stroke, as these problems often indicate that the entire circulatory system may be compromised. Regular eye exams can also play a crucial role in early detection. Ophthalmologists and optometrists are trained to recognize signs of vascular damage in the eyes, and can refer patients for appropriate medical care when necessary. Recognizing vision problems as potential early indicators of stroke underscores the importance of comprehensive health care that considers the body's interconnected systems. Sudden headaches. Headaches are a common ailment that people suffer from for a variety of reasons, from tension and stress to sinus problems, or dehydration. However, there are exceptions, and sudden, severe headaches that seem unusual should not be taken lightly. Some individuals can experience these intense headaches a month before their stroke. They often come on suddenly, and are more severe than they might have experienced in the past. In some cases, these headaches can be accompanied by other symptoms, such as nausea or vomiting. If you're experiencing a sudden, excruciating headache that you've never had before, it's important not to dismiss it. Sudden, severe headaches can be indicative of a number of medical problems, including certain types of strokes, aneurysms, or other neurological problems. Although not all severe headaches lead to a stroke, they should be investigated immediately by a healthcare professional. It is always best to err on the side of caution and seek immediate medical attention if you experience this type of headache. Numbness or weakness in limbs. One of the most recognizable and alarming signs of an impending stroke is the sudden onset of numbness or weakness, often affecting one side of the body. This may manifest on the face, arm, or leg, and is often accompanied by a feeling of heaviness or paralysis. The numbness or weakness may come and go or persist for a long time. This symptom is a clear indication that something is interfering with the brain's control over muscles. The main cause of this symptom is an interruption in blood flow to the brain. When a blood clot or ruptured blood vessel interrupts normal blood flow, the brain does not receive the oxygen and nutrients it needs, leading to these motor function problems. This is a medical emergency, and if you or someone you know experiences this symptom, it is crucial to act quickly and seek immediate medical attention. Timely intervention can make a significant difference in the outcome of a stroke. Difficulty speaking. The ability to communicate with other people is fundamental to our everyday lives, and when this ability is compromised, it can be a cause for serious concern. Stroke can affect your ability to speak and understand what is said. If you or someone you know has sudden speech problems, it is crucial to seek help immediately. These speech problems can manifest as slurred speech, difficulty forming words, or even difficulty understanding what others are saying. The brain regions responsible for language and communication can be affected by a stroke, leading to a disruption of these vital functions. The reason behind these difficulties lies in the disruption of the neural pathways and circuits that control language. The sooner you take action when you notice speech problems, the greater your chances of a positive outcome. Timely medical intervention can help prevent further damage to these vital areas of the brain, and can also facilitate faster recovery. Communication difficulties can be particularly distressing, and addressing them promptly is essential to the well-being of the affected individual. Memory problems. Memory problems can be indicative signs of cognitive changes linked to an impending stroke. These changes can manifest as forgetfulness, confusion, or difficulty concentrating. Before a stroke happens, if you notice persistent memory lapses that seem unusual or worsen, it may be an early sign of stroke risk. These cognitive changes can result from compromised blood flow to the brain, which can result in the brain not receiving the oxygen and nutrients it needs. Memory problems can also be associated with other stroke risk factors, such as uncontrolled high blood pressure, diabetes, or high cholesterol. If you or someone you know has these memory problems, it is essential to seek medical evaluation and address any underlying health issues to reduce your risk of stroke. Loss of balance. Loss of balance and coordination can be indicative of a cerebellar stroke. The cerebellum, located at the back of the brain, is responsible for balance and motor skills. When it is affected by reduced blood flow or a clot, you can experience difficulty maintaining your balance and coordination. This symptom can manifest suddenly, making it challenging to stand, walk, or perform everyday tasks. If you or someone you know suddenly experiences a loss of balance without an apparent cause, it is critical to seek immediate medical attention. A cerebellar stroke can have severe consequences, and early intervention is essential to improve the chances of a successful recovery. Loss of balance is not a symptom to be taken lightly, as it can lead to falls and further injury. If you experience such symptoms, especially in combination with other warning signs, don't hesitate to call for immediate medical help. Early intervention can prevent further damage and improve the chances of regaining balance and coordination through rehabilitation and therapy. Nausea and vomiting. Nausea and vomiting are common symptoms that can be associated with a number of health problems, including viral infections, food poisoning, or motion sickness. However, they can also be associated with an impending stroke. Disruption of brain function caused by a stroke can trigger these symptoms, especially when combined with other warning signs. These digestive symptoms may be accompanied by other stroke-related signs, such as headache, vision problems, or difficulty speaking. Understanding that nausea and vomiting can be associated with an impending stroke is crucial for early detection and timely medical attention. If you experience sudden, severe nausea and vomiting, especially in conjunction with other unusual symptoms, it is essential not to ignore these signs. Sometimes digestive issues can be the body's way of signaling a larger problem, and seeking immediate medical attention is the most prudent course of action. Recognizing these 9 warning signs of a stroke is vital in the fight against this life-altering condition. Each sign has unique characteristics, and understanding them can be the difference between a timely response and irreversible damage from a stroke. When these warning signs present themselves, seeking immediate medical attention can be the key to preventing further damage and improving the chances of recovery. AVC is a stealthy adversary, but with knowledge and awareness, we can be better prepared to detect and combat its threats. Your health and well-being depend on it. I trust that you enjoyed the content, and click on the like button, subscribe to the channel, enable notifications, and share the video with your friends and family.